the State Medical Board of Ohio presents a brief introduction to Ohio's acute pain prescribing rules. To get started, let's discuss the challenge we're facing. The nation is in the midst of a serious opioid epidemic that has resulted in profound consequences to Ohio's economy and our way of life. For example, each year about 4,000 Ohioans die from a drug overdose. And based on law enforcement drug seizures, the country has seen a major increase in drug reports involving fentanyl, an extremely lethal opioid that is 30 to 50 times more potent than heroin. The good news is that we can reverse this trend by working to reduce the misuse and diversion of opioid prescriptions. Did you know that many individuals who are addicted to opioids received their first pill through a prescription? This could have come from either a valid prescription or diverted from a friend or family member who had a prescription of their own. To address this issue, it's important to note that research has shown the majority of acute pain issues resolve in 5 to 7 days. Through Ohio's acute pain prescribing rules, we aim to reduce the frequency and amount of opioids prescribed for acute pain. Take charge of the epidemic. The State Medical Board of Ohio is teaming up with partners across the state to educate patients about the new limits on opioids for acute pain. But there is also education that can be done during consultation. Here are the rules for physicians and physician assistants when prescribing an opioid to treat acute pain. No more than 7 days of opioids can be prescribed for adults. No more than 5 days of opioids can be prescribed for minors. The total morphine equivalent dose of a prescription for acute pain cannot exceed an average of 30 morphine milligram equivalents per day. Any opioid prescription for acute pain in excess of the day supply limits, or MED limits, must be documented with a specific reason in the patient's medical record. Effective December 29, 2017, indicate the day's supply on all controlled substance and gabapentin prescriptions. Prescribers of as-needed medications should consider the following. Patients may not need the maximum daily dose every day, or may taper doses after a few days of use. Patients may not be consuming the medication continuously, i.e. around the clock. Also effective December 29, 2017, include the first 4 ICD-10 code of the primary disease or condition the opioid is being used to treat. The ICD-10 code is required on prescriptions for all controlled substances as of June 1, 2018. There are a number of free websites and apps to help you quickly look up ICD-10 codes. A link to these can be found on takechargeohio.org. Some electronic medical record, or EMR systems, can automatically include the ICD-10 code out of a patient's chart and electronically transmit or print it on the prescription. If your EMR system is not able to do this, you will have to manually write the ICD-10 code on the prescription. Some electronic prescribing systems may also be able to use the notes field for transmitting the ICD-10 code. To assist prescribers in calculating a patient's morphine equivalent dose, the State of Ohio Board of Pharmacy has developed a conversion chart that can be accessed at pharmacy.ohio.gov/MED table. For resources on how to write a valid prescription, MED calculators, ICD-10 code lookup apps, and answers to frequently asked questions about Ohio's acute pain prescribing rules, visit takechargeohio.org. Thank you again for taking the time to learn how you can make a difference in your community. Together, we can take charge of this epidemic and help create a safer future for Ohio.